right to go. There are 105 active cases of coronavirus in Victoria, with 5 new cases since my update yesterday. Those 5 cases are linked to known outbreaks, and 1 case was reclassified. There are 9 Victorians in hospital, and none of those 9 patients are in intensive care. A total of 3,002,936 test results have been received since the beginning of the year. That's an increase of 18,442 since yesterday. We thank each of those 18,500 people for what is a profound contribution to our fight against this virus. The most complete picture and an appropriate public health response to stop the spread of this virus is essential to the opening up that we all desperately want to do next week and in the weeks to follow. So we're very grateful to each and every one of those almost 18,500 people. There are 8 healthcare workers who are active cases. The rolling average to 21 October is Metro 6.1 cases, Regional Victoria 0.4 cases, and the total mystery cases to 19 October are 10 in Metropolitan Melbourne, none in Regional Victoria. Of the 5 cases today, they're obviously all in metro areas, 4 in Hume, 1 in Banyule local government areas. There are just 3 of those 105 active cases, just 3 are in Regional Victoria, and they are the 3 cases in Greater Shepparton that we've reported on consistently for recent days. There are now just 5 active cases linked to residential aged care, which is a very pleasing result given the vulnerability of that sector. Now, Jerome has joined us as the testing commander. Alan is here as Deputy Chief Health Officer, and they'll speak in more detail about that Northern Metro, those clusters and that outbreak, and the excellent public health response that has been brought to that very challenging set of circumstances. Testing, we always say this because it's simply perhaps the most important fact. Testing is critically important, particularly when we get outbreaks. That's what was so successful in Kilmore, it's what was so successful in Shepparton, and indeed Chadstone and other outbreaks that we've had in recent times. To that end, can I send a really clear message to those in Northern Melbourne, Northern Metropolitan Melbourne? There are a number of sites that are set up for testing. I'm now going to read through those. All of this information can be further explored around operating hours and exact physical addresses on the website, but if I can just take you through: Broadmeadows Central Shopping Centre, Coolaroo Respiratory Centre, but that's by appointment only and only for symptomatic testing; Melbourne Airport drive-through testing site; Craigieburn Health Service drive-through; Roxburgh Park Youth and Recreation Centre, that's a drive-through as well; 29 Timmins Street in Sunbury, that is a walk-up site; Highlands Hotel is a pop-up site at this stage for today only, but we'll have further information if that needs to be extended. Austin Hospital is doing testing. 21 Alamein Road in Heidelberg West is a testing site. 14 to 32 Civic Drive, Greensborough, that's a drive-through site. Northland Shopping Centre has its drive-through site which people can access, and CB Smith's Reserve, 79 Dukes with a J Road, Fawkner, is a testing site. It is critically important that anybody in those local communities, and indeed anybody across the whole state, even the mildest of symptoms, please come forward and get tested as soon as you possibly can. Delaying for a day can mean that the virus spreads, and indeed many people, hundreds even, can finish up in ISO in their home. That could be prevented, and of course we do know that there's a lot about this virus that we're not certain of, and we don't want anyone to get this. We want to do everything we possibly can to stop the spread of it, because it can be deadly, of course, but it's also something that every day we learn more about this, and there's a growing body of international evidence that for many people who are otherwise healthy, can be quite young in fact, if you get this, it can be very hard to shake. It can be a long-lasting chronic illness rather than a cough or a cold that you would get over in a short period of time and barely register 3 or 4 months later that you'd had it. This is a novel virus, and we have to work very hard, all of us, to make sure that we're doing everything we can to stop the spread of it. Testing is critically important. Now, there are many hundreds of people that are in ISO at home as a result of these northern metropolitan outbreaks. We thank them for the part they're playing in stopping the spread of this virus. Advice to different groups within that total cohort of around 500 may change from day to day. We will engage as clearly and as often as we need to, but I just wanted to speak to why that advice may change. There are groups of people that are isolating for just 48 hours while we get testing done to make sure that we can, if you like, eliminate them from any potential chain of transmission that's linked back to a positive case. If that information changes, that's for the best of reasons. It's almost certainly because the person that they've had contact with has not tested positive, or somebody that they were in contact with has not in fact tested positive. This is the way we operated in Shepparton. This is the way we operated in Kilmore. This is the way we've operated in recent weeks. That abundance of caution, cases, their close contacts, and then the contacts of close contacts. That means, yes, hundreds of people are locked up at home. That's not pleasant, but that approach means that for hundreds of thousands, indeed millions more, there will be a greater freedom of movement, hopefully, next week, following announcements we will make on Sunday. So again, I do thank all of those people for the contribution that they are making. It's not pleasant to be essentially isolated from everybody, with none of the reasons that the rest of us are allowed to leave home. They don't apply. Only urgent medical care, for instance, would be the reason you could leave. That's not a pleasant circumstance to find yourself in, but it does make a massive difference in pulling up this virus and stopping the spread of it. Again, Jerome and Alan are here to say a few words, and then of course we'll take any questions you have. I might throw to Jerome first just to speak about outbreak management, those incident teams that have gone in and that are working very closely with a large group of people and have done a very good job in containing this. But the next few days will be very interesting for us as we get further test results back and as we see exactly how far has this spread within that broader group. As at today, it's about 500. It may be that there are more people who have to isolate as a result of that testing. It can go the other way, that a test confirms linkages rather than letting people out. So I'll throw to Jerome now, then Alan might have a bit to say, and then we'll take any questions you've got.
Thank you, Premier. Just to confirm the current outbreak we're dealing with in the northern metropolitan suburbs, and I'm talking in particular here about Roxburgh Park, Dallas, Broadmeadows, Preston, East Preston and West Heidelberg. We currently have 16 active cases across 6 different households. That's an increase of 5 from yesterday. I should stress that the 5 positive cases today are all within the established close contacts within those households, and we've had a total of 36 people who've been impacted by this outbreak over the last couple of weeks. We now have had a significant development in this particular outbreak where a student attended East Preston Islamic College on Monday and Tuesday of this week, and he was identified as a close contact on Tuesday. He was tested on Tuesday and he was tested positive, confirmed positive yesterday morning. The school, and I'd like to pay particular thanks to the principal of the school and the entire school community. The school took a very swift decision on the Tuesday when they were aware of the close contact status to close the school for deep cleaning. The school remains closed for this time being. As the Premier said, our expansive approach, based on all the work we've done over recent weeks, means that we've now identified 73 close contacts at the school. Those are predominantly students at the school, but also some teachers, and they and their households have all been asked and instructed to self-isolate, to quarantine for the next 14 days. That's a total of around 400 people at this point in time, who under our orders of primary contact, secondary contact, have all been asked to isolate for those 2 weeks. Obviously, my huge thanks to all of them for their collaboration. They were all contacted yesterday. We have provided some alternative accommodation options for all of those families. That work continues on to this day. Some have been successfully rehomed for that period of time in order to enable them to self-isolate and quarantine safely and effectively. We also have a close contact at Dallas Brooks Community Primary School up in Dallas. That became, we were aware of that yesterday. That school has closed as of today, and we are now doing secondary contact tracing. So the close contact was identified yesterday afternoon, yesterday evening. The school has been closed today. we are doing secondary contact tracing with that school today. I'll identify any further knock-on implications for that in terms of isolation. Again, my thanks to the entire school community for their support in handling this event. And then finally, we've had a positive household in community housing in Broadmeadows. They have been identified positive. We have actually managed to put them into alternative relief accommodation, and they've been very collaborative in that process. We have 31 other residential units in that housing accommodation, around 120 people in total. As at last night, we advised all the residents of that block that we would like them to remain in their homes for the next 48 hours to self-isolate and to get tested. The testing station turned up yesterday afternoon, started yesterday, continues today, and over the next few days. We are keen to test everybody, all the 120 people in that accommodation block, to make sure we really understand any potential change of transmission. I should stress this is an abundance of caution approach. We are taking the view that although we have every reason to believe that the positive case was contained within that particular apartment, we don't want to take any chances, and therefore we will test anybody in that surrounding area to make sure that there's been no onward transmission, and we'll conclude those conversations over the next 2 days. As the Premier said, we have over a dozen testing stations in and around these locations that we're now working through. Most of those are open 7 days a week for extended hours. We have pop-up stations also additionally sited, particularly in Broadmeadows, in West Heidelberg, and there'll be other pop-up stations emerging in East Preston and other locations over today and tomorrow. Our focus very much is that we will continue to work very closely with both the people impacted by this exposure, but also with the wider community. We had a lot of people on the streets yesterday, door knocking and encouraging people to check themselves for symptoms and to come forward and get tested if that was the case. That work continues today. And I'd like to extend a particular thanks certainly to our community health partners, to the primary health networks, to the local councils, and to all the community groups we've been working with over the last week for their sterling support. This is a significant and complex outbreak. As the Premier has said, we have around 500 people now who are self-isolating. We're obviously providing significant support to those families, both financial and in terms of food relief, and we'll continue to adopt that approach for any other people who we identify over the coming hours and days to make sure that they can isolate safely and effectively. Finally, my plea, as ever, is that for anybody, particularly in those suburbs, in Roxburgh Park, in Dallas, in Broadmeadows, in Preston, East Preston and West Heidelberg, if you have the remotest symptoms, if you have any concerns whatsoever, even if you're just a little bit unsure, please come forward and get tested, and we will support you and your family to self-isolate effectively and to make sure you get through this well. Anyway, of course, that extends to anybody else in the wider Melbourne area and across the whole of Victoria. We've seen some very solid testing numbers over recent weeks, and again, that is collectively what's helping us to build a really good picture of where this virus remains as a threat to our community, and to ensure that we can provide this really swift, responsive, and literally deploy hundreds of people, as we're doing right now in North Melbourne, to addressing any residual traces of this virus. Thank you very much indeed. I'll hand over to Alan.
So just one issue that I'd like to address is the issue of reinfection. There were 5 new cases yesterday, but there's a 6th case that has been classified at this stage as a reinfection. So people who test positive having had infection previously do represent quite a difficult issue, and the debate is whether they are persistently shedding viral fragments, or do they actually have a new infection. And we have an expert panel to look at these, and some of the factors that we take into account is, the clinical details of the first and second infection, whether they have symptoms and how sick they are, how much virus appears to be present the first and the second time, how long it has been since the first infection and the second infection. So obviously if it's very close, then it's less likely to be a reinfection, but if it's a long period of time, and particularly if they've had negative tests in between, it's probably more likely to be a reinfection. We look at whether the person has a compromised immune system, look at their whether they've had close contacts the first and the second time. And then finally, we also can look at the genomic testing to see if the first and the second strains are the same. These take a little while to close out, and we take a very precautionary approach to say that if we're not sure they are a reinfection until we have evidence to show otherwise. So they are, obviously very frustrating for the people involved. They aren't common. We think that there are probably only a handful of reinfections reported to the world. And at this stage, we actually do think that people who have recovered from infection are mostly protected, at least for the first few months after infection. Just make a point that there is a difference between these cases that we're dealing with at the moment and the ones that are reported in the international literature. So in the international literature, they have definitive evidence to say that the first and the second strains are different. These ones, we haven't got the genomics back yet. We don't know, so therefore we're taking a precautionary approach and treating them as if they are potentially infectious and putting them in isolation, checking their close contacts. So in terms of, obviously, one major issue is about the implications for these mystery cases or not. And obviously our level of worry about these mystery cases, in inverted commas, is a little bit less than for other cases. We have a potential explanation. We've done a lot of testing around these people, their close contacts, people upstream from them, to see if there's any other sources or contacts there. But they do, and we are putting them in isolation and their contacts in quarantine until, while we continue to work out exactly what's going on here.
Can you talk us through how many contacts of that case are in quarantine? Like how, as you try and work out exactly what's gone on, how many people are affected there?
Look, I don't have the exact numbers for this person, but it's basically their household and then any other places they've been. I haven't got the numbers for this one.
So is it fair to say that this one is still under close investigation? It may take some time to really figure it out?
Absolutely, yeah. Yep.
Had this person tested negative before leaving isolation?
Yeah, so we do see that. So yes, they had been cleared, and they actually had tested negative. We do see sometimes that, and this is even in people that are cleared, we can see tests that sort of flip between positive and negative for a little while. This, I understand, this person. There have been a few of these cases just in recent times that they had tested negative for a little while, and then it sort of popped up again. It's just the property of the test. There's a lower limit of detection, and there's just a small amount of viral fragments. That I do have to say that the test is extraordinarily sensitive, and that's why we often detect some of these cases where there seems to be prolonged shedding. And just an example of that, for example, wastewater testing. You can imagine how much, how many viruses there are in the sort of huge volume of wastewater, and it is able to pick that up. So it's an extraordinarily sensitive test, and in some ways it's too sensitive. It picks up viral fragments and not always live virus.
Alan, can you talk us through just on the epidemiology of the Northern Metropolitan outbreak? I think Jerome mentioned before that this would be fair to say this outbreak's been sort of bubbling away at the surface for a bit, and it's really come to attention because of the primary school case.
Yep.
Can you just talk us through that and what DHS was doing before that primary school case on Wednesday? Because I understand there were some reports that a certain child was cleared by DHS, but his siblings. There may have been some conjecture there. Can you give us any insights?
Yeah. So there's contact with these families or these households, pretty much every day. I think there probably was some confusion that is probably understandable. So, we hear this quite a lot. There is a difference between isolation and quarantine. So isolation is about how long you're infectious for, and then there's a process to be cleared from that when your symptoms resolve, and it's usually about 10 days. Quarantine is about how long it takes to get sick after you've been exposed, and that actually is longer in a lot of people. So what had probably happened in this case was that the people that had infection had been cleared and said they can come out of isolation, but the people that hadn't had infection were still in quarantine, and there was obviously some confusion between that.
There is a suggestion that these people, there was a translator involved, but there wasn't any documentation that was provided in the correct language for the original family and for cases involved. Are you aware of that at all?
I'm not sure about that. It's pretty clearly documented in our notes what had been told, but clearly the message that was received may have been different, and I'm not entirely sure about translators in this case.
Is it correct to say that if a family contract COVID COVID that each member has a different person from DHHS looking after them? And why is that? Why isn't it one person per family to ensure communication is clear?
Yeah, yes, I think that's the approach that we will take, is about case managing the family rather than each person having a case manager. I think it is, it is understandable that there can be confusion when there's multiple people in the family, and the symptoms for some start on a particular day and they're cleared on a particular day, and it is unfortunately one of those things.
So is that the case now, that each member has a different case member?
It will be the approach going forwards. Yeah.
So from today
I'm not
that
sure
changes?
what happened last weekend, but it is the approach that we're taking now.
Okay, can I also ask, it may be a question for Jerome, just around the timing of yesterday. The text message went out to people in that area about 3:30. A hotspot list came out at 5:30, and this cluster wasn't mentioned on that hotspot list at all. And it wasn't until 11:40 that the wider public were told about what was happening in that area. Why does it take 8 hours for the public to find out what's happened in that area, especially when you were able to mobilise testing centres? Why wasn't the wider public told at 3:30?
Well, so just to go back to that narrative. So what we did yesterday and what we do continue, we've talked about cases in these suburbs, and of course every day we produce analysis around where the current active cases are by LGA area. So some of these cases, some of the 11 cases that we've had, have been visible certainly for a week or so. And yesterday we put out a targeted reminder by SMS to 3 different suburbs, catching about, I think, 140,000 people from memory. Across those 3 suburbs, to say, look, we are aware of COVID cases in your area. We'd like you, if you have symptoms, to go and get tested. It's consistent with the messages that we all give on a very regular basis, but more targeted, because we're very keen to connect people to their place and where they are. And that was effective. We've seen a bit of an upsurge in testing in some of our testing stations in the northern suburbs over the last few days. So the SMS messaging, we've had people door knocking over the last few days in certain key locations. We've had a lot of work with local councils, a lot of work with different community groups across a whole range of different sectors of our society. So we've been very active over the last 10 days in encouraging and supporting this particular outbreak. What ramped up last night, and the release was the crystallisation of the outbreak, or the student at the positive case at the East Preston College. That was a significant development, as was the close contact we identified last night at the Dallas Community School. So those are the developments that we then wanted to ensure we gave that a higher profile.
So my question was, why weren't the wider public told?
Well, I think the wider public were told. I mean, we've been telling the wider public for the last 14, 15 days about individual cases in these LGA areas. That, as Alan has said, those cases have been developing. They've been well contained, and all the positives we've seen so far have been contained within the close contacts identified at the very start. So we've seen no breakout of this one at this point. That's been well controlled. That's been well communicated consistently over the last couple of weeks. In terms of, I think, targeting SMS messages goes to the public. Now, I'm sorry if you didn't get a press release about that, but our focus is about getting information into the public where they are, to say this is something that's happening in your community. And we've seen before with those SMS messages, we've used them 2 or 3 times before. They do create attention for some people who maybe not involved with the mainstream media, and they may respond to that. So we will use any channel and every channel to communicate with people, to encourage them to do the right thing.
Could you have been clearer though, Jerome? Like, I'm just looking at all credit to DHS and the hard work they're doing. I'm just looking at the show updates that have gone out on Wednesday and Tuesday, and all it says is 13 active cases are currently linked to the North Metro region community. Yeah. Could you have been a bit more specific on that when it went out?
Look, I think at that point that what's changed in the last 24 hours is we've seen a connection to 2 significant schools. And that is absolutely now a cause for significant response now by our teams. And as we've seen, we've now have 400 people that during the course of less than 24 hours yesterday were asked to move into isolation and quarantine. Many of those have been offered and relocated overnight into other alternative forms of communication. So we've had to step up our response significantly yesterday. Last week we were not in that situation, because these cases at that point were well contained within their households. They were well contained within their close contacts. As I've said, we had 36 people who've been on this journey with us over the last 10 days or so, who are those close contacts and positive cases that have been going through. So we don't wish to unnecessarily alarm people, but we are saying on this particular case, look, we're seeing a bridge across into a school. That's sort of suddenly it's gone from 36 people being asked to self-isolate and to quarantine. It's now 500. That's a big step up. We've got a lot of work to do with those people over the coming days to make sure that they're okay, that we understand which of them are currently positive, if any. As we go through that process, we may be able to release some of them. That would be a great result. And if not, we'll have to ask them to isolate for longer in the interest of the wider community.
When did we first become?
Andrew?
The call to test, because the anecdotal evidence from the northern suburbs is that you may not be getting the response that you had in Shepparton or Kilmore.
No, look, I think if I look at our testing results for the for those 10 or so normal sites that we've had that the Premier listed out, we've seen around a 8 to 10% increase in daily testing numbers at those sites over the last week or so, which kind of reflects the more local approach and targeted approach we've been taking. So I'm not disheartened by that. Obviously today, last night, we're starting to make a bit more noise about this, and there's a more general appeal. And I have to stress, this is to everybody who's living in the northern suburbs. This is not something which is confined to a particular community. This is something that affects all of us. The 500 people that are in isolation are a cross-section of the Melbourne community. So this is something we need everybody who's not feeling great in those northern suburbs. I need you to get tested today.
Does the department alert schools about children that should be self-isolating? Do you talk to schools?
I'm not that close to our school context, but yes, we've been working closely with the 2 schools that are at the centre of this outbreak at the moment.
But I mean, just in general, before this, like there's children that should be self-isolating.
I'll have to take that on notice. I'm not that close to our school
In
context.
terms of the timeline, when Ellen referred to the confusion about who should be isolating, when did that actually occur, and when did DHS find out that was occurring?
With regard to
The people that got confused over when they should isolate.
And I'm not going to go into individual cases, obviously. We have a household with a significant number of family members in the household. They have, I think, now all gone through a positive cycle at some point. It dates back to at least over 2 weeks now. During that period of time, individual members of that household will have been given very direct communications about their individual status and about when they are due their day 3 test, when they're due their day 11 test, and at what point they're being released from quarantine. Similarly, that is also part of the daily follow-up that we have with everybody who's going through this process. There are very regular check-ins, both on their general health and well-being and any symptoms that they're having, and to make sure that they're being supported and well looked after. All those checks have been undertaken on this particular case. My assessment of that situation is that there were a number of people who were released from their quarantine period having no longer being infectious from that household, but there were other members of that household that were still defined as close contacts. They had not yet tested positive, and one of those members of that household did attend school on the Monday and the Tuesday. He had his day 11 test on the Tuesday, and that turned positive.
So the communication with this family hasn't worked, so what do you need to change now?
Well, look, I think we continue to do, we wrap a lot of care around positive cases, and particularly as our overall case numbers go down, we're starting to work more closely with people. I think we are progressively moving more towards a case management approach where we group households together and say, how do we manage you as a family unit or as a household unit? That work is starting in some parts of our state. We'll accelerate that as we go forward.
So should this case have been addressed?
Whilst you can easily build a construction that says, one contact for the whole family, some of these families are very big. There is a significant age range, and without casting aspersions on any individual family, just as a broader point, the notion that there's one phone call to say mum or dad and that will filter through the other 7 or 8 people who live in the home, we've got to be a bit careful not to assume that necessarily means everybody gets the most complete picture. It's got to be intensive. Within the bounds of infection control, we are moving to a model where we go and sit with the person and the family, the household, and take them through all that the next few days and weeks will mean. But that's a bit challenging too. The last thing we want to do is have public health people transporting the virus around as they move from one house to the next. So there is always a risk that people don't do as they've been asked, or aren't 100% clear on what they've been asked, and everything in between that. This is a very human business. It's a very human set of circumstances, and you will get some variance. But ultimately, someone who should not have been at school went to school. They weren't positive. They were a close contact. They have subsequently tested positive, and that's what's then seen the response in that school and all the other settings kick in. Just on text messages versus media alerts and lists of places that might be high risk. You know, I got a text message at home a couple of weeks ago saying that in my suburb there had been positive cases. Didn't mention outbreaks, didn't mention any given sites, and I don't even think we've had in my local community significant outbreaks, you know, multiple people. But it's just one of those things we do to send a message. This is not a statewide issue, it can be very local. In your postcode, there's been a positive case or a couple of positive cases. If you've got symptoms, please go and get tested. So it's kind of separate. They might relate to the same geographical area, but they'll relate to different points in time. And of course, a text message in the early afternoon would, I think, be unrelated to the information that we became aware of during the day about the school and the exposure sites that we were able to put out much later in the evening.
My questioning around that, sorry, is just that, you know, what about people that had travelled through that area that didn't get that text message? In the release that came out last night at about 11:40, it does say that the text message went to people that were visiting the area. So is that correct, that a text went to people?
As I understand it, much like a bushfire text, it's based on the GPS of everyone who's got a mobile device who's there in that geographical area. So if you were a visitor and you're there, you'll get the text message just like you would get a bushfire warning. I think all I'm saying is there's no argument here. I'm just saying that the text message is not necessarily the same thing as a list of sites, and one of the reasons for that is we do the text messages whether there are a list of sites or not, and then when and if a list of sites becomes available to us because of more detective work, then a separate media release goes out. They're the same area, but they serve two different purposes, and their knowledge base or the reason for them is different. And obviously, a list of sites is more complete and is more about individuals who've been to a site. The text message is more about, in this general community, there is virus. If you've got symptoms, please come forward and get tested. So they same day, same suburbs, but they come from different places and they serve different purposes.
Social housing block in Broadmeadows.
Yes.
Can you tell us where that block is?
No.
Are the residents all aware?
They've all been informed that they've got a couple of days inside while we test them all. It's around 120 people. It's not a tower, it's out in the suburbs, so it's multi-storey, but it's not a public housing tower as we would see closer into the city. They've all been informed, they're all being absolutely supported, and we'll get those tests done as fast as we possibly can to rule them out.
Yeah. So is it advisory notices to them, or
no, they need to.
Is it a similar thing to what happened in North Melbourne and Kensington? That's where I'm getting to.
Oh no, I don't think you can compare it because it's not quite the same scale. It's simply working with each of those residents to say, look, there could well be virus in this block of flats, not a tower, I stress, and we want you to stay at home. Don't see anyone, don't go anywhere. We'll look after you for a couple of days while we get you tested, and then hopefully we can rule you all out as not having this virus, and then we can push on from there.
Is that a clear isolation order though to the people in that address?
I understand so, yes.
Yep.
And it's also a close contacts, but it's also kind of getting close to the notion of contacts of contacts. It's not quite there yet, but it's absolutely precautionary, and it's. Can I put it to you this way? It's not so much a statement of the vulnerability of those people, although there will be some vulnerability there. That is, in broad terms, the nature of social and public housing. It's more about they do live quite close to each other. The same approach would be applied if it was a private block of flats. It's not that they're being singled out because they're public housing tenants, and it's not for 14 days as it was in the 9 towers where we did that, where we had no choice. This is a precautionary thing just while we get tests done. Now, it could be that some of those people test positive and then they'll need to do 14 days. And while those tests are being done, we're doing all the contact tracing as well, assuming they've got it, because now we move from cases, contacts, and their contacts. So
does that mean anyone that's been to that address, like not just the residents, but anyone that's been to that address, caregiving, all the 4 reasons,
yes,
and the close contacts of them, they need to isolate?
They'll be being contacted and we'll have an appropriate public health response based on
So
when they
once
were
they
there.
get
And
contacted to
Sorry.
be told to, so they need to wait until they get. If they say I've been there, right?
Yep.
And I'm waiting to hear from DHS. Like, what's your message to that person?
Well, there won't be many people waiting because we're going through, and we have been overnight and again throughout the course of today, and we'll work out who's been, for each of those people, who's been there. That contact tracing work will go on, and we'll be in contact with people as and when we need to. So I think it'll relate to things like, well, who did you visit, when did you visit, how long were you there, all of those things. It's not, there are 3 groups. There's not 12, because you could literally go out and out and out all the way through contacts of contacts of contacts and then add another 5 rings. We're not doing that just yet, but the testing is being done. It'll be done as fast as possible. They're being supported to stay at home to wait for the tests, and we're also working out who's been there, who they've been with, so that we can have that 3rd ring as it relates to them. So those people will be contacted as soon as they possibly can.
So the 500 will grow.
It
The
may.
500 in current
It may.
isolation. Yeah.
It may, and at the same time, it'll shrink pretty quickly too, as we get more people that are waiting for a test. If they're cleared, if your link back to the case does not test positive, then after a period of time you may well be allowed back out, and that's that kind of precautionary approach.
What are the implications if those people don't wish to be tested?
Sorry?
What are the implications if those people don't wish to be tested?
Well, then the assumption would be that they've got it and they'd stay inside for 14 days. But we've not had people refuse to be tested, and we've got a number of different methods we can use. So there's the swab, there's the
So not one person
cup
refused
test as
so
well.
far?
I don't believe anybody said no.
And just
And
back
I think
on-
people are keen to, particularly when the result may well have all the conditions that have been placed on you taken off. I think people are pretty keen. But we announced, I think, a week or so, maybe 10 days ago, that maybe a little longer, that if you did not comply with your day 11 test, then we would assume that you were positive still. We can't clear you, and you'd be in for another 14 days in different settings. I don't think we've had to do that anywhere. Once it's made pretty clear, look, you need to do this. It's not very pleasant, but you need to do it so that you can go about your business. The answer is almost exclusively yes.
And just back on Bridget's question regarding what needs to change about the situation with the school student who attended school whilst infectious.
Yes.
If this was to occur tomorrow, what would actually be done differently to prevent that from happening?
If
we have a family
The
situation.
breakdown of communication.
Oh well, again, I think that I'm not conceding the point that people were not told what they needed to be told, whether they fully appreciated that or whether, and sometimes you'll never know, and it's often the assumption is, oh well, they must have got told the wrong thing. No, families can make a choice, and some have throughout this pandemic, that they will go and do certain things that they shouldn't do. So in any event, every case is an opportunity to refine, to learn, but there are limits. You can triple check, quadruple check everything. The notion of going back and providing the same message 9 times does get a little bit difficult. So I'm not necessarily conceding that point on the specifics. More broadly though, we're going to extraordinary lengths to make sure people know and understand what they have to do and to support them to do it. It's not a set and forget, here are your rules for 14 days, see you on day 15. That's not the way it works. It's intensive, it's regular, but it is very human. And when you're talking about families of some size, the notion that everybody's got absolute clarity exactly when they need it, sometimes that won't happen. The point I'm making is, despite our best efforts, and they are extraordinary, the lengths that we go to. But if we have to go even further, then that of course we'll always try to.
So how's this family done anything wrong?
I don't want to get into having discussions about who's done what, but I would just say this: the virus might be airborne, but if people do go from one house to another, which is not in accordance with the rules, this thing will hitch a ride. That's what happens. Now, we can't change what's gone on here. It's not a matter of blame. It's just a timely reminder, yet again, to the Victorian community that each of us make hundreds of choices every single day. There are millions of us, so that means hundreds of millions of dangerous opportunities where things can go wrong every single day. That's why we've just got to stay the course on this and make good choices.
So are clearance letters being sent out in different languages or just English?
I understood so, and I understand also that anybody who, through the course of their management and the support we give to them, if English is an issue, or if there are any other issues, and there are many others beyond language and a person's heritage, we take every step we possibly can to make sure that they know where they're at in that time sequence, and they know what's required of them, and we know what needs they have. So there'll be, like any cross section, there'll be people who perhaps English is not their first language. There'll be other people who perhaps are older and may need more support to understand concepts and need to be perhaps reminded more often of things. There'll be other people who are very young for the same reasons. They need to be supported. There'll be people that have got mental health issues. There'll be people that have got alcohol and drug issues. It's just, the list goes on and on and on. It's every variable and every complexity that makes up the community. And the key point is, because the virus doesn't actually discriminate who it latches onto. So it is an incredibly complex task, but the efforts are second to none, in my judgment, to try and make sure that everyone knows where they're at, what they have to do. And I stress this point again, so that everyone knows what we can do for them if they've got issues around getting scripts filled, groceries, various other support that they might need that they might need. It's absolutely a two-way thing. It's not just orders and things they have to do, it's also stuff that we can do for them.
Here you go, Noel.
Yeah, sorry, thanks. If we're going to move to a family case management style model for those situations like this, can there be a supervisory element to that, even up to and including, close supervision by law enforcement to make sure that rules are being adhered to?
We have had some of that as a feature of the pandemic response. I won't necessarily go into the details of individual cases, but if we have a fear or a suspicion that people will not do as we've asked them to do, and I stress that does not relate to any of these current cases, but this is a matter that's been actively considered, and I'd be very confident, without necessarily tipping people off to what arrangements might be put in place. They're all appropriate and they're all risk-based. If we had a sense that you were not going to do the right thing, then there's a lot at stake here. There's a lot at stake, and these are compulsory orders. They're not voluntary. They're compulsory orders under the Public Health and Wellbeing Act. Now, this would be a tiny fraction, a tiny percentage. I want to stress that. But sometimes, if a person, for whatever reason, not just deliberately, but that there's just a doubt that they'll be able to be compliant because of their personal circumstances, that's sometimes where we'll say, okay, we've got a place where you can go and stay, and we'll look after you. Because the other thing too is, you might live in an environment where it's not that you're inviting people to come in. People can be moving in and out of the environment that you live in. You may not have complete control over that. So you may inadvertently be coming into contact with people. There are literally 1,000 different examples of what might drive that. But what I'm saying to you is that I'm not sure if we've used it, be a handful of cases.
Obviously, this is a different situation to those public housing towers, but is
Yes.
the Broadmeadows public housing block, does it have a police presence outside?
Don't believe so, no. I don't believe so. Everyone there is being isolated for the purposes of a test, just a couple of days. I think everyone's willing to do that, and it's a really important thing that they're doing, not just for their own health, but their family, and indeed all of us. And as soon as we can update you on any of those test results, we will. That'll be a feature of tomorrow and the day after, probably.
The 73 close cases
Sure.
at the school,
Yes.
close contacts of students and teachers, and then they have another 400 close contacts. Should we just be testing all of them? Should we be waiting till day 11? Why don't we test them?
I think there'll be a mixture of testing as well as waiting. Some people, there's also a very detailed clinical judgment made about where in the cycle are you. Sometimes you can get false positives and then people then go about their business. Other times, people will be tested at the right time so that we get the most complete picture, and the test is the best reflection of whether they've got it or are likely to get it, if you like, if that kind of makes sense. The other point here too is that we've got significant testing capacity. In fact, it's fair to say that as we move to open, we're going to finish up with more own source testing capacities, not having to rely on interstate capacity than we have ever had, and I'll make some announcements probably about that next week.
And can I just ask on the 11-day test if you said if someone refuses that test, then they are counted as positive. Does that positive get added to the daily total?
No, because it's not a positive test. We just treat them as if they were a positive. If they subsequently tested positive, well, then we get into some of these reinfection debates. But that you've got to be a reinfection, then you've had 2 positives. The significant time has elapsed, and almost certainly a negative test in the middle. And then it goes to Alan's panel, and they go through all that and try and work out whether they can call it one way or the other.
Premier.
Some community leaders in the Islamic community today saying that they're quite fearful that this attention on this case and this sort of outbreak might spark a sort of another round of potentially blaming the Islamic community for the virus in Melbourne. What would you say to that?
I'd say to those faith leaders and all Victorians, this virus does not discriminate based on your postcode, where your mum and dad were born, the language you speak at home, the place where you go to pray, or if you don't go to pray. This virus is unconcerned with any of those things, and so should we be unconcerned with any of those things. This is not a function of faith, far from it. So nobody in the Islamic community should have that sense. The other thing too, I'll just be really clear. There are some people in different communities, many communities, not just that community, but many different communities, where there can be from time to time, and we've had this very direct, very personal feedback, not just through official channels, but in talking to people over these last 6 months. There are some in different communities across the state who may feel a sense of shame or stigma that they've got a positive test. No one should feel that. No one should feel that ever. This is not about those issues. It's about coming forward, getting tested. If you're positive, you're doing your job. You're doing the right thing in coming forward and getting tested. There's no sense of shame. In fact, we will praise you for the fact that you've done the right thing. You haven't ignored your symptoms. You've come forward and got tested, and then we can work with you to stop you giving it to others and them giving it to others, and so on it goes. There's no shame or stigma. There's no judgment. There is privacy. When you do that interview, it's like talking to your GP. All we're interested in is the coronavirus information so we can stop the spread. So it's not a cultural thing, it's not a faith thing, it's not a postcode thing. It is everybody's business, because it will infect everybody unless we have the sort of measures in place that we've put in place.
How is Metropolitan Melbourne and Regional Vic looking for your signposted announcement this Sunday? I believe you said on last Sunday that the CCC and Public Health have been reviewing the data each day. How's that going?
We have, and I'm confident that we'll have more to say on Sunday, but frustratingly, again, the nature of this virus, I can't predict what tomorrow's numbers are or the day after. But once we've got those and we've made the sort of final touches and the final refinements to what's possible and what's deemed safe, then we'll have more to say on Sunday. That won't be coming into effect, hours later. As I've always indicated, there'll need to be a few days when we ease into that, but we are still hopeful. But we do have to wait until Sunday.
Is it looking positive though? Like in the
I think so. I think so. I wouldn't. There's a power of work going on in the northern suburbs. These are very significant numbers of people that are very well contained, if you like, at the moment. But the issue, the virus is, that means we could get further positives. But it goes back to that point I've made many, many times. With low numbers, it becomes as much about the story behind the cases as it is the case number itself. So the 5 today and the 3 yesterday, they were household contacts. They were known to us. We had our arms around them. They're part of the public health response. They're not mystery cases. They're not cases that have popped up out of absolutely nowhere. I'm not saying you would expect that these people would become positive, but we've obviously had our doubts that they would. That's why they've been isolating at home. So that's a very different story than 3 or 4 cases in 3 or 4 different parts of the city where we can't work out how they got it.
The key thing to watch at the moment, from what you've been laying out in the last couple of weeks, has been the mystery cases. So how, and maybe Alan wants to add in.
Alan may do it. They're steady at 10. I haven't got Alan can speak to whether there's any that are due to drop off in the next couple of days because of the 14-day period. And there's also been a process to examine a whole range of those cases, because they're kind of line ball. We might have a suspicion We might have a set of circumstances around them where, yes, they might be a mystery, but we know they can't have given it to anyone else because they've been in a certain setting in a hospital, which is one example we've had recently. But Alan might want to add to that.
Yeah, so 2 cases will drop off. So no cases will drop off the mystery case list tomorrow, but 2 cases will drop off the day after that and 1 the day after that. There are a number of cases like these reinfections and the child at the Royal Children's, where we're looking into them very closely, and we're basically going through that list every day. You know, what do we know more about it than we did yesterday? And can we just have a look at those? I think there are some of these cases where we're a little less concerned than, true mystery case that's been out in the community, and that's all part of the sort of decision making. So again, it's not when, if it's 6 but one of them we're not so worried about, then or 7 and 1 or 2 of them we're not so worried about, then we'd probably still be okay. But
it's all right for a couple of hundred racehorse owners to be gathering at the Cox Plate on Saturday.
Look, I think that issue's been dealt with.
Well,
Yeah.
I guess the question though is, why isn't it okay for larger groups of people to be gathering outdoors at, say, religious ceremonies, at funerals? I mean, you were clearly okay with a larger group being there on Saturday, which suggests that conditions would allow larger gatherings now. So why not?
Yeah, so we are planning to speak with religious leaders over the next couple of days, and trying to work out sort of what is the safest way to allow them to observe their faith the most safely. I think with all events we look at the settings, and if it's a particularly large space, then things are a little bit different than in a smaller space. So
the cathedral's pretty big. I mean, you could probably fit more than 10 people in there. But
and it's not it's also not outside either.
I might just, it's not happening. If it had happened, it's one event. Like, there's mass every single Sunday. There are prayers at mosques every Friday. So, and the thing is, it's not. We don't need to go back over this, but I'm just making the point. It is not happening, and we explained why.
But you decided it was okay for that.
Yeah.
So I guess I'm just asking.
Yes, but I think it's important. The only point I'm making, Lundy, is this: it's important to acknowledge that was one particular event on one day, right? The notion of dramatically expanding right now for Saturday, or for now, a number of other settings, you'll soon have many more than a few hundred people in aggregate terms availing themselves of all of those options. That would not be safe. That would not get the tick from the public health team. In any event, it was the wrong call. It's been fixed, and on Sunday, just a couple of days away, we'll be able. I'm very confident we'll be able to have more to say about faith gatherings, and that'll include some of the ones that you just mentioned.
I probably agree with you that it was the wrong call, but I'm just wondering why the health advice was different for that. And I mean, a racehorse owner's immune from the virus. Like, what? Why
No,
but
Andrew, the same. The point I'm making to you is this: if you're talking about 120 people at a race for a period of time, right, an hour, all the settings that you've just spoken to, that'll be well more than 120 people in hundreds, if not thousands, of different locations all across the city. So they are different. One is a single thing. It was wrong. It's been changed. It's not happening. But I think we need to be careful in comparing that with not just one event, but with many events that might occur on that day or in the days to come. That's the only point. That's the only point that I'm making. It's not about classes of person or different categories of people and their immunity or otherwise. It's just about one was for one setting. Others, like the ones you've mentioned, would be in multiple settings and could well be many more people than what we were talking about there. In any event, it's not happening. And on Sunday, hopefully each of the very important examples you've given and many others will be able to confirm what those next steps will be.
If no one else can have an event, why can they have an event?
Sorry?
If no one else can have an event, though, why can they have an event?
Well, they're not.
Why are they?
That was only a decision made after you had faced major social media backlash, and the government looked at the decision and said, hey, we got it wrong here. So why could that, and I'm very keen if we could hear from Professor Chen to outline the specific public health advice that led to the Cox plate being ticked off. Could we get that from?
Well,
Professor
you can,
Cheng?
but let's not just skate over the fact it is not happening. And on Sunday, and on and you can speak over me if you want to, but that's not the way. Simon, please, let me just finish the answer, and then you can ask Professor Cheng whatever you want. But one event with 100 people is not the same as hundreds of events with hundreds of people. They're just not the same. It's not the same thing. And if we're to be criticised for having listened and then changed the arrangements for Saturday, well, so be it. I think that's far preferable to have pushed on. But it is not appropriate to make comparisons. One event with 100 people at a point in time versus hundreds of events with hundreds of people, that is a different thing, a very different thing. And that would not be approved. And it has not been approved, and that's why there's not hundreds of events going on with hundreds of people on Saturday. There's not even smaller events with just a handful of people, like another family coming to your home to watch the footy.
So are those types of events more likely to have public health approval when things open up a bit more with the one-off type?
We'll have to wait and see. Well, no, look, I think it'll be more because of the passage of time that will make it more likely that things like that will be able to be. We'll be able to say yes to them, whether it's Boxing Day test or the tennis. Like if the Boxing Day test was being held this Monday next week, then obviously there'd be a much smaller crowd than will be available in a couple of months' time. That's the point that I'm making. Alan, sorry.
I guess if you were happy a couple of days ago to have a few hundred horse racing types together, yes, why can't a grieving family have an extra, say, 5 or 10 people at a funeral today?
No, I understand, and that's why it's not happening, because we can't.
But I guess the health advice was obviously.
Yes, it was, and I want to make the point that there's not perhaps just the one funeral. There might be many funerals, and therefore they are deemed a different risk. No one is pleased about that. No one. But the fact that those two things do not sit easy with each other is one of the reasons why this is not occurring on Saturday. There will be a time for those sorts of gatherings. That's not now. And also, Lundy, there'll be a time, and hopefully it's quite soon, where we are able to have more people come together to celebrate the life of someone that they've lost. The point you make is exactly the reason, or one of them, why this is not occurring.
And just to clarify, you said that you would allow the health advice before. You said, yes, I will. We will allow that health advice to be released.
No, Simon wants to know the answer, and Professor Cheng is about to tell you.
Look, I think some of the factors that it's not like we're expecting 1,200 people to just gather in one spot. That was not what was presented. There are people that are involved in, the jockeys, the strappers and so on that are running the event, and they're very separate from other groups. And there was certainly a plan for, other people to be well separated in small groups. So that was sort of some of the things that we took into account. It's very different to a mass gathering of 1,200 people.
So you had clear scenarios presented to you by Gather, Moonee Valley Racing Club and the government through Triple C or before Triple C, and it was pretty clearly set out how you were going to manage those people. Is that right?
Yeah, I mean, yes. There's public health advice as to how many people and where they would be and how they what would prevent them interacting with each other and so on.
What capacity does DHS in future, regardless of any announcements on Sunday, have to assess those sorts of one-off proposals?
I mean, especially for these, every circumstance is different. So, it's a certain configuration, a certain number of people that are required to, run the event and so on. And we just need to make a judgment on each of those things as to whether we think it's safe or not. So we clearly can't, assess every single event, but for these larger ones, we can do that. And they are all different in different ways. So we just need to make that call as we see it.
Professor Cheng, do you currently believe it is unsafe for more than 10 people at a funeral?
Yes, but I think that is changing over time, and we hope that I can't exactly remember what the regional situation is, but it's slightly different, and it will change over time, and we hope that by next week or the week after that.
How do you
that
then
will be different.
prioritise though? I know you say they put a plan forward, etc., but how do you prioritise a group of 500 over a group of 10?
So again, it's not 500 people that are all gathering in one,
But if
and
you
all
know
interacting
maybe
with each other. They are spread out over a period of, and there are safeguards to stop, people more than 10 gathering together. It is a very different situation to.
Do you still believe it would have been safe had there not have been backlash? Still believe it would have been safe to have held 500 people extra at the Cox Plate this weekend?
Look, I think the decision's been made, and I think
Sorry,
the decision
is,
that's
do you
made is
still
appropriate.
believe on public health it would be safe?
Look, I think the decision made was
Sorry,
appropriate.
just my actual question though, Professor Cheng. Do you still believe it would have been safe for those people to be at the Cox Plate this weekend?
I think that the event could have been run safely, but I think the decision that's made is appropriate.
And just confirming you don't believe it's safe for more than 10 people at a funeral?
At this stage, yes, but I hope and expect in the next week or so that will change.
Just looking ahead to the reopening of sorry,
No, if you have a question.
just on the reopening of looking ahead to the reopening of retail, are they going to need to do things differently to the reopening in the first wave? Like, are there extra, precautions you're wanting shops to take?
Yeah, so there is a plan for all industries. I haven't got it in front of me to know the exact requirements, but it spells out things like density quotients and recording people that have come in and so on. I can't remember exactly what it is for retail. Certainly for hospitality, for example, there's the requirement that they take down names of people so that we can contact them if something happens, and there's one for pretty much every industry.
And has that evolved much from the first wave, from when we came out of that?
Yeah, I think there are certainly differences, and there's a lot of things that we've learned since the first wave. So I haven't got it in front of me to know exactly what is the same or different. I can get back to you on that.
Premier, have you heard about the Moorabbin Cafe that displayed a sign which encouraged people to pay $1 more?
What I'll say, yeah, I have heard about that. What I'd say is this, right? People can put up signs, whatever signs they want, but signs don't work against this virus. And in defence of that cafe owner, I might also point out that online abuse doesn't work against this virus either. So, I wasn't offended by it. There's been plenty worse things written about me on walls and in newspapers than that. I would just say that doesn't actually protect anyone, and abusing that bloke, that doesn't protect anybody either. And I think he's had some pretty nasty stuff directed his way, and I just don't think that's right, and I'd ask people to not do that. That does not serve any purpose at all.
Have you got any thing you could say to the small business community just about Sunday's announcement?
You've done an amazing job. I know you want to reopen for yourself, for your profits, for your people as well, for your staff, for your customers, for everybody, and for the best of reasons. We want you open again too, and we hope we can take some further steps, announce some further steps on Sunday, so that we can find that COVID normal and then lock it in. And I'd be really confident that businesses large and small will all do the right thing. They'll work really hard to be safe, because if they don't stay safe, we won't stay open. That's really on all of us. But Sunday's the day, hopefully, to be able to give them a clearer sense of what the coming weeks and months look like.
Premier, just on the reports of an investigation into documents being leaked regarding the roadmap, do you think that it is appropriate for Victoria Police to investigate the leaking of documents, those particular leaking of documents?
I don't have any thoughts on those matters. They're not matters that involve me. Cabinet in confidence documents are under law very important documents that need to be appropriately protected, not just now, but every day of every year. And that's been the case for decades and decades. That's not a matter I've just spent more time answering your question than I've had thinking about that matter. It's not a matter that I am particularly concerned about. That is not something.
Were you asked about it before it was referred to police?
Sorry?
Were you asked about it before it was referred
No,
to
police
police?
police don't ask me.
No, in terms
Or-
of internally
No.
before it was referred to police.
No, those processes A person might be a public servant, but they don't work for me. They're not employed, but hired by me. They're not disciplined by me or managed by me. That'd be a matter for.
Were you asked about it before the referral happened?
Well, no, I don't believe so. No,
In
and I
terms-
certainly wouldn't have been asked. You know, what did I think about whether they should be? That's not a matter for me. I don't involve myself in those things.
Just on the northern suburbs outbreak, how worried are you about that spreading? It
In
sounds
terms
like,
of Sunday,
sorry, the northern suburbs
Yep.
outbreak. How worried about that are you of just spreading in general? It sounds like you think it's pretty well contained at this stage.
I believe so. However, we do have a lot of people that are at home waiting for a test, or they're at home waiting to get well, so that they're not moving around making other people sick. But it's a significant outbreak. It is incredibly complex at a family level, at every level. It's a very, very complex set of circumstances. So everyone's working incredibly hard. We'll just have to see how these things unfold over the coming days. But we've been very quick to act, and we do have a lot. We've cast the net very wide. That's the approach you can take when you get numbers low. So I'm confident that we can pull it up. But I can't, in all good conscience, I can't tell you that there won't be more cases tomorrow, or more the day after, or indeed, you know, there could be other settings that become known to us and become apparent through chains of transmission that aren't yet completely understood. That could happen in coming days, but we think we've got a pretty complete picture of it now, or as complete as you can have.
Can I ask off the back of that?
Just wanted to clear that up at all.
I don't believe so.
No, thanks.
It's more about the school. The school public health response is more about whether a student has infected others, whether that be teachers or staff.
Can I ask about that outbreak as well? How much are you looking at the sewage testing in that area? I think there's a Western plant. Is that giving you a better idea of how much virus is
Yeah,
out
we
there?
might have to come back to you on that. But can you, Alan? No worries.
So, sewage testing in Melbourne isn't very helpful at the moment, because people can shed virus for up to 7 or 8 weeks after they've had infection. So clearly, 7 weeks ago there was quite a lot of infection in Melbourne. There are in regions it's obviously very different, and actually it's so all the regions have pretty much been okay, and except Kilmore and Shepparton triggered positive just as we're discovering cases there. So that does give us some reassurance that sewage testing is going to be useful. But in Melbourne at the moment, there's been a lot of cases. There's going to be positives at the moment.
You mentioned before that there may have been some confusion in this Preston case about the terms isolating and quarantining. I just looked over the press release that was released on Preston, and the terms isolating was used in what you just described as a quarantine situation in the official press release. Does there need to be more clarity from government about when each of those terms are used? Does that need to be stricter?
Yeah, look, those terms there's always a lot of confusion, and often the terms are used, when we talk about it interchangeably, but in epidemiology they're slightly different. I think what's probably most important is to give very clear messages to the family. This is what is required for each member of your family, and the dates where that happens, whether it's isolation or quarantine. Obviously people will always get that confused, but we need to make sure that there's sort of strict and clear instructions to families about what is required. And part of the problem is that may change. So there may be a requirement for quarantine, but if they become a case, then then they change over to isolation, and then all the dates change. So it is unfortunately relatively complicated, and when there's a lot of people involved, it's even more complicated.
Is that your understanding of where the breakdown has occurred in that difference?
I'm not sure. I wasn't involved in the interviews, obviously, but I do understand that the family were communicated with each day, but clearly there has been a breakdown somewhere.
Just on the issue of the regions, what are you doing to ensure that Melburnians heading out to the regions for property maintenance stick to the rules?
Well, there are financial penalties if you don't. It's important to, within a structure, within a formal process, to go and make your property fire ready and indeed flood ready, given some of the forecasts we've received from the Bureau. I just say to everybody, Regional Victoria has done an amazing job, just as people in Melbourne have too, but Regional Victorian numbers are low, and they've stayed low because Regional Victorians have played their part. And it's just not acceptable for anyone to go to Regional Victoria unless they have a lawful reason to do so. and the rules follow you. The rules from Melbourne go with you. So if you're going there and you've got the permit, you've got the tick from the council to go and do the work you have to do at your holiday home or your farm or wherever it might be, that doesn't mean you can go to the pub because the pub's open. It doesn't mean you can go to Bunnings because Bunnings is open. It means you're there to clean your property up and then get back to Melbourne and be quick about it. That's the key here. There's too much at stake, and you know, I just say to people, you'll be. I think the community that you're visiting will take a pretty dim view of you perhaps not doing the right thing and potentially spreading this virus. So we would hope that didn't happen. Plus, of course, and again, this is designed to make it easier for those who are offering all those services, whether it's at Bunnings or the pub. There are penalties for them if they were to serve you without having taken reasonable steps to ascertain that you are a local and that you should be there lawfully. So, there might always be isolated cases, Lundy, but I would hope that people do the right thing, and I would also remind them that there are penalties if they don't.
There are reports of heavy roadblocks being set up throughout the Peninsula Link and around the Yarra Ranges. Is this in anticipation of people expected to be going there a lot more?
This is in enforcement of a 25-kilometre rule. And the 25-kilometre rule there's there for a number of different reasons, but one of them is to make sure we don't finish up with crowds of people forming that are unlawful crowds. They're too big, and I think it's fair to assume that places of great beauty and great interest to people like the Mornington Peninsula or the Dandenongs or wherever it might be might well see large numbers of people, particularly if you get half decent weather, and we've got long weekends coming up and all of those things. The 25Ks won't be there forever. It'll come off when it can. The metro regional boundary won't be there forever. It'll come off when it can also. And I'll have a little bit more to say about that hopefully on Sunday.
So essentially, is there a list of hotspots which are suspected places where people may choose to go against unlawfully that police are targeting?
Oh, well, we've seen... I would leave it to police to talk about that, and they'll give you as much or as little information as they think serves the purposes of public safety and numbers and all that sort of stuff. I always let them do that. But what I would say is, we saw down, I think it was the Mornington Pier a few months ago now, it was a sort of a pop-up whale watching exercise, and there were literally hundreds of people there. Now, you can't have that. We just can't have that. And it's not hundreds from one household even, it's hundreds from hundreds of households, and all of a sudden if there was someone who was positive, you've got a super spreader event. It gets very, very difficult. Now, that was at a different time. We are moving towards a set of circumstances and an epidemiological place where a lot of things that weren't safe 3 months ago will be safe, or at least we can build up to them and make them safe as the weeks and months pass.
And just ask questions, please.
Am I backing who?
You can go and then I'll go.
I was just going to ask you about the police flag this morning. They're going to use drone surveillance over grand final weekend. Are you okay with that? And how? I mean, if I could drill down to a personal level, how would you feel about a drone flying over your nearest park or near your home?
Well, I can fly drones over my place because no one will be doing anything wrong. We'll be following the rules, and no one should have any problem with that, frankly. But the police don't ring me and say, Premier, can we use these drones? That's a matter for them. They make those decisions and roadblocks and all of that stuff. My job's to give them the resources and the rule book that they need. I think they've done a great job in very challenging circumstances, and they will use technology to make sure that we can open up. That's what these rules are for. Nothing more, nothing less. It's about using technology and old-fashioned community policing as well. The number of people. This is the thing. In many respects, the most important thing. I will get you the number. I don't have it to hand. There are literally hundreds of thousands of Victorians who rung the police assistance line because they've had a suspicion that next door or across the road or down the street are doing the wrong thing. And they're doing the right thing, and they're angry about it. And some people have sort of looked down their nose at that, dobbing in your neighbour. Well, no neighbour has the right to do the wrong thing. We've all got to see this through. And I've called out Saturday night. I know it's a special day. I know normally we'd all be gathering in lots of different places. And we'd have a drink, we'd have something to eat, we'd enjoy the game, whether our team was playing or not. This is a different grand final because it's a different year. And if we want a summer that looks much more like a normal summer, then we can't be going around to our friends' houses or gathering in unlawful groups Saturday night. We just can't do that. It's not worth it. It's just not worth. Give back everything we've done and put at risk things that I will announce hopefully next week, and then more to come weeks after. We don't want to give that back.
To the two phone calls that went to Lisa Neville on March 27, one of which is on the record coming from your office, were you aware of these calls being made at the time or afterwards?
Not at the time, I don't think, no. I think that as a function of evidence that's been led to the inquiry, I now am. But again, in terms
Were
of...
these made by your Chief of Staff?
Well,
One
in
of
terms
them
of
made
what-
by Lissy Ratcliffe?
In terms of what questions have been put to me, and what questions have been put to others, you need to speak to the inquiry about that. We've had a steady and consistent position. I went to this yesterday, whether it be in terms of witness statements or any additional material they've asked for. It's really not appropriate for me to be answering those questions while I'm answering your question while I'm answering their questions at the same time. If they want to give you further information, then that's entirely a matter for them. I wouldn't presume.
Lissy Ratcliffe made at least one of those phone calls to Lisa Neville on March the 27th.
Well, I think I would simply refer you to the answer I've just given, and I'd refer you to the evidence that's been led. I think you confirmed that yourself in your first question.
In terms of the affidavit that you've been asked to provide, or the
Yep.
questionnaire, was any of those questions in relation to phone calls made from your office on March 27th? People from your office?
Yeah, there are a number of questions, and they all relate to sort of completeness sake type issues that they're not new issues as such, and it will not require me in any way whatsoever to change the evidence that I have provided. I just want to make that
Will
point.
you have to provide new evidence? You keep saying that there was no clarification, there was no
It
correction, but have you
it is not a
provided new evidence?
by virtue of it's not my experience that inquiries ask the same question multiple times. So they're new questions, but they don't cover areas or ground that I would say was anything more than for completeness sake, given that or the sake of completeness, given that there's been some developments, Mr. Eccles and others. So I've got no difficulty with the questions. They've asked them, we'll provide the answer, and it'll be handed up, and then it'll be a matter for the board to do with that as they see fit. It is, again, I would simply say it is, it seems to me, one of those exercises where they feel obliged to ask a number of questions for the sake of completeness, and it's on that basis they've asked. I would assume, but I can confirm for you, at all points, at all times, we've been fully cooperative, and you'd expect nothing less from the very person who set the inquiry up, I would have thought.
Are you aware of the substance of those phone calls that were made on March 27th to Lisa Neville from your office?
No, I don't think I'm in a position
You don't think you're aware of what's in those phone calls?
Well, you're asking me about phone calls. I'm not going to speculate on.
No, I asked whether you are aware of the substance,
Substance
of
of
the phone
them.
calls that
No,
were made
and
from
I'm
your office.
sort of searching I'm trying to answer you very carefully so as not to give you anything other than an accurate answer. There would have been lots of phone calls made that day. To the extent that we're both referring to the same phone calls, no, I don't believe. I wasn't aware of them at the time, so...
You're not aware at the time, but you're aware of what they are now?
The substance or the fact the call was made?
The substance of... You've already admitted that you're now aware of the phone calls?
No, I can't speculate on what that was. I think that people will have talked about different things, and it'll be for them to, we will answer the question. We will answer the questions that the inquiry has put forward, and I really don't want to trample on that process.
Previously, you said that no one else, your office said that no one else had been required. You'd been handed over phone records, but not affidavits or statements to the inquiry. Has that changed? Have your staff now been required to answer?
I don't believe that's changed, no.
And Premier, have you had
And any hesitancy on my part is simply trying to be as accurate as I can. The questions have been provided, they'll be answered, and I'd expect anyone who'd been asked further questions by the inquiry to do exactly the same. But I can't sit here to the highest of standard and quote you back verbatim what was said on a phone call months and months ago. But there's been evidence led, and my evidence will not be required to be changed in any way, shape or form as a result of the additional information that the board has asked me to hand up.
And are there any discussions or any early plans to restructure the Department of Health and Human Services after what's been going on in the pandemic?
I'm not here to make any announcements about machinery of government matters. We will await the board's final report and we'll take the appropriate steps. I can't foreshadow what they'll recommend, and I'm not here. And I'm not here today to. But I'm also not here to foreshadow what we may or may not do independent of that report. That'll be a matter for us to consider.
Separate to your evidence or adding more evidence or questionnaires and affidavits, have you had any request yet from Jennifer Coate to extend the reporting date?
No. And just yesterday, so we don't have to do this every day, I'll give you a commitment. If such a request comes forward, I'll make sure that you know about it.
Thank you.
Just one more.
But I have not had such a
Just
request.
one more on the Northern Cluster.
Not in the last hour and a half, anyway.
Why, can we just clear up, and it could be for Jerome or Alan, why
Yes.
are members of a household allowed to get back out into the community before everybody in that household has been cleared?
Right.
Is that a question for you, or is that a question
No,
for
it'll
Alan?
be a question for Alan. It probably relates to whether they've had the virus or not. I would think.
Yeah, so just to clarify the difference between quarantine and isolation. So isolation is about how long you're infective for. That is often shorter, not always, but often shorter than quarantine, which is how long the incubation period, which is how long it takes to get sick. So people, and then obviously there's the matter of timing. So, when people got sick as well. So people are often infective, and if they're released from isolation, they can go out. But people that are in quarantine may need to still stay in, and that's obviously the confusing part of this.
It is quite confusing, I think, for
It is, isn't
everybody.
it?
Right.
Yeah.
So
I mean, I think going back to the point before, rather than trying to, work out which is quarantine and which is isolation, what we really need to say is, for this person, this is when we anticipate that you'll be cleared from isolation, or you can come out. This is when this person needs a test, and based on the result of that test, what happens. So everyone needs a clear plan. But some of the complexity is that people that are in quarantine may become cases and then need to have an isolation period, which is separate, and that may change over the period of time. So that is probably a good case for a case manager to say, okay, this is the list of people. Let's just go through this, work out who needs a test when, who can who's being cleared when, and then and when they can be out. So a person to answer your question, a person in isolation often can come out earlier than someone who's in quarantine.
And on that public housing block, they're all in isolation. Does that mean is there people helping them get the necessities? What are the rules there?
Yeah, so people that are coming in will use infection prevention measures to make sure that they don't get infected, so they're not regarded clearly
So they're
as
solely
as-
staying in there and people will come to them?
Yeah.
We'll be looking after scripts, groceries.
Premier, just back to the leaking of documents from government departments. You've referred to Cabinet in confidence documents, but do you think that all documentation which is leaked has been leaked from a government department during the coronavirus pandemic should be investigated, including the emails in regards to the Sutton matter?
I'm not making any judgments about any of that. I answered in terms of Cabinet confidence because they would be the documents of the most seriousness. Again, these are not decisions that are made by me. Departmental secretaries, there are codes of conduct, there are rules in place, there are laws of the state, in fact. So I could just as easily have said to Alex, my answer could just as easily have been, I can't usefully speculate on that and I can't answer your question.
Has
But
that
I
been
thought I would just make
referred
the
to
point around
police?
Cabinet in confidence documents that that is not a new notion, that is not a Labor notion, it's a notion that's been there for decades, some would argue centuries.
Has DHHS referred that matter to the police?
I've no idea.
And do you think that they
I have
should?
no idea. You would need to speak with them, and I don't propose to be directing them. Their secretaries under various acts of parliament, other officials and staff, all are obliged to do certain things, and they take those responsibilities very seriously in my experience. But as for those matters, that's entirely a matter for others.
Have we set the date for the budget yet? And if not, what are we waiting for?
Well, it's a very big document with a lot of spending in it, a lot of investment. It needs to be appropriately put together, and we'll make announcements in due course.
Will it be set before the inquiry ends? I guess the speculation is if they happen at the same time, that's two pretty big things that are happening at
No,
once.
I can give you a guarantee that they will not be happening at the same time. And those who've advanced the notion that the budget of the state is somehow used as to distract people, I would simply say they need to have a closer look at the sorts of budgets that we deliver, that we actually hand down. They're budgets of consequence, they're budgets of reform and investment, and I'd like everybody focused on the budget on that day and in the weeks and months and years afterwards, because the investment out of it will be profound.
Tim Pallas.
We'll have more to say about when budget day is, when we are ready to make those announcements.
Tim Pallas did come out a week ago, I believe, and talked about how the budget seemed to be in a fairly formed position, and so I guess, what are we waiting for? Why is it taking such a long time?
We'll make the announcement when we are ready to make the announcement, and I won't be making the announcement before I'm ready to make the announcement. That is the prerogative of the government, and we will make that announcement when we see fit.
Will it be this year?
Yes, there'll be a budget this year, and it'll be the biggest budget that the state's ever seen. Exactly when this year will be the subject of announcements that will be made by the Treasurer when he is ready to make those announcements. Much like the contents of the budget will be delivered as we believe appropriate. We might give you some hints in the lead up to it, and then we might do the rest of it on budget day. There might even be some things that happen and become apparent to you in the days and weeks after the budget. That's how big it's going to be. It needs to be, because we're in unprecedented circumstances. Any other issues, guys?
Halloween.
I'm going to.
While we're doing it.
I have never directed the Chief Health Officer, but I am going to direct the Chief Health Officer to come up with a Halloween plan, Alex. That you can have joint sign off, I reckon. I know it's apparently it's a big thing for many families. I expect that given the passage of time and the sequencing that seems logical to me, this is not till the end of the month. We're going to be out tomorrow, Saturday. We'll be out on Sunday with some announcements, and hopefully that will clarify those matters for the benefit of all who are very interested in it.
For the benefit of everybody in the community who are worried that the circumstances in the northern suburbs is going to derail the progress that we've made over the past few months towards opening up, what's the message?
I wouldn't be drawing any of those conclusions. There's always some uncertainty with this, because we don't know what will happen tomorrow, let alone in weeks to come. But we think we are well placed on Sunday to have more to say. But every Victorian can be reassured we will only take steps that are safe. We've come too far to then sort of lose our nerve as a community and rush to COVID normal. You can't sprint to it. You just can't do it. It's got to be done in a steady and safe way, and that's exactly what I'll talk about on Sunday. And I'll also, just for completeness' sake, I'll also try and give people a sense of what November looks like, what December looks like. But again, they'll all be very much based on what occurs in the weeks and months in between Sunday and then. But Victorians have done an amazing job. They continue to do an amazing job. And I'll just make the point, 2 final points. If you've got symptoms, get tested, and get tested today. That is what I need you to do for you, for your family, and for every family. I wouldn't ask as often as I do if it wasn't so important. It is critically important. And the final point, Saturday night is not an ordinary grand final. It is not an ordinary grand final, and you simply cannot be breaking the rules, or you will set us all back and put at risk everything we hope to build for summer and for 2021. If there's no other matters, we'll see you tomorrow. Thank you very much.